Hello, my name is Holly Miller, and I have recently received treatment for retinitis pigmentosa with Dr. Yu. I've had very good results. I was diagnosed with retinitis pigmentosa about 30 years ago. I quit driving at night at 19 because it became very difficult. Since then, I have gone back almost yearly for more testing. I have always been told that it is very important to come for more diagnostic testing because it's important that I be in the system when the cure comes. 30 years ago, they told me, the medical doctors in the United States told me that the cure was right around the corner. They told me that we are working on something that shows great promise, and that probably in 5 years, with the advancement of medical technology, that there will be a cure. So I continued to go for many years, and while these hard-working, intelligent, well-meaning people have fantastic diagnostic equipment, and with their current, I believe still currently, they are unable to heal or have a treatment for retinitis pigmentosa. I also was a little leery coming here because in my yearly encounter with the medical doctors, frankly, the only person that walked away from the encounter with anything of tangible value was the doctor who received and accepted my payment. So after years, it became very disillusioning. I want to speak to you about how I'm seeing and tell you my results, but first I would like to ask, if you are a medical doctor and you have patients with retinitis pigmentosa, please do not dismiss this valuable treatment simply because it lies beyond your current training and it lies beyond the limits of your current training and understanding. I came here, and if you're a patient with RP, I highly recommend coming. Have talked to so many patients from all over the world that are having good results and improvement. And the best I was told that I could ever hope for was maybe a ceasing in the degeneration of my retina. The one thing that impressed me, the first thing, is when I called, I was able to talk directly to Dr. Yu, not to, other people in the office. I've never been able to talk directly to the doctor. I've been seen by medical doctors in Oklahoma City, Oklahoma, Boston, Massachusetts, Los Angeles, California, Bellevue, Washington, Moscow, Russia. And to my knowledge, currently they are unable to be effective in treating retinitis pigmentosa. On the other hand, when I came here with Dr. Yu, I am considered functionally blind with tunnel vision, and my most painful situation was painful stabbing glare. So I was continually wearing a visor and sunglasses and would get great eye fatigue, and also the glare would create what I feel like was whiteout. It would seem to, like in a bad photograph where I was still able to distinguish the images, but the contrast and where the image began, it kind of faded out like a ghost. Now I am having extreme clarity and a new vibrance in colors, and my contrast is much better. I'm able to go down the steps now because instead of being a continual slope, I can actually see the definition of the steps. And while I'm still using my cane a little bit in very dark places, I'm walking without it and without even holding my husband's hand. It's unbelievable. Having the pain gone, I can't tell you what a gift that is. And the clarity and the...
What pain you refer to?
The pain from fluorescent lights
Uh-huh.
and sunlight,
Uh-huh.
it would make my eyes squint, and it just would cause stabbing pains in my eyes. And the first or second day, I think after the first treatment, that diminished, and by the second day, the pain is completely gone, like a miracle.
How's the glare to the sunlight then?
The glare to the natural light is very much improved, probably 90%. I still have a small amount of glare from fluorescent light, but nothing like it was.
So what kind of protection you use for the glare before, and what do you use now?
Well, I always had to have the visor. Even if I was going to a wedding and all dressed up, I would have to stick on my ball cap looking visor, even inside. So from a vanity standpoint too, that is lovely to not have to wear that anymore. I would wear protective over my glasses, dark sunglasses, to try to help with the glare. Now, I walk many days, even though it's a little overcast, even on overcast days, it was overwhelming, the light coming in. And so I've been walking without my visor and many times without my sunglasses. I believe that Dr. Yu's humility, and he's not arrogant. I was so surprised to see a doctor who's actually, I've talked to people from all over the world that he's helping, and they're returning again and again, bringing their children so their children don't have to experience what I've experienced. I believe that his great understanding of the human body and its energy systems, coupled with what I sense is a deep spiritual understanding, enables him to be an effective healer in the treatment of RP. I highly recommend that you come, don't wait. He doesn't make any false promises. He told me very clearly on the phone, I do not know if it will work for you, but come and try, and if it does not help you, I'm not going to have you come, you don't have to come back. So I feel like this is the first exchange in a long time with a doctor that I am actually walking away with something of real, tangible value that is beyond the money I've spent. So I'm so happy. My husband's happy. My parents are happy. My friends are happy. So
experience here. The people are very friendly. We've enjoyed our time, in addition to getting great treatment. And I can tell you without a doubt that Holly's had significant improvement. She's able to confidently get around in restaurants now. She was able to go to the restroom completely by herself and get back to the table with no issues.
Dim lit restaurant?
Dimly lit restaurant, yes.
Mm-hmm.
I mean, this is a remarkable change.
Mm-hmm.
And I expect we'll see continued progress, and we're really excited about it.
How about reading, Holly's?
Well, I haven't been able to read in a long time, but we did receive our check when we left the restaurant.
Mm-hmm.
And we were sitting in a well-lit room, and the print wasn't super tiny, but for the first time I was able to read him the total of the check.
Without CCTV?
Without CCTV.
That's great.
So it's just been astonishing and almost seems like a miracle.
So when you first discovered our website, and what's in your mind? Do you believe in it? What's in your mind when you first discovered it?
When I first discovered the website, I first of all recognized very quickly that even though the story seemed unbelievable and miraculous, I was able to identify that the people were not paid actors. And the reason I know this is because I have RP, and only people with RP can speak about the specific problems to RP in a way that is real and that convinced me that these people definitely are having a benefit.
Yeah.
But because of the long time of what felt like almost a carrot being dangled in front of me, you know, and stressing the importance of, you know, the only thing I would leave the exchange with all the medical doctors I've seen, like I said, they got the payment and really I got nothing except some advice. And that was, Holly, it is very important. It is of the utmost important that we get together and do this again next year.
Yeah.
So this is very different than that, and just been amazing, a wonderful gift from God.
Yep.
And Dr. Yu.
Yep. So what's the difference you see in her in the last 2 weeks? We have been here 2 weeks. Yeah.
I mean, changes were noticeable within 3 days. It's very obvious within just a couple of days. In fact, she noted how bright the colors were on the TV.
Oh, color, okay. Sharper, huh?
Very much sharper. Colors in the room, some of the paintings in our hotel room were much brighter, clearer, easier to see than she'd seen. She hadn't seen those colors in years.
Oh.
And I didn't even realize how black and white, not completely black and white, but how dull the colors had become. And the brilliance and vibrance of the colors, it's just stimulating.
Wonderful.
Yeah.